I'd like to welcome all of you, and I'd like to introduce Central Pacific Bank's Executive Chairman, Paul Yonamine, to do the welcome.
Hi, thank you. So everybody, welcome to the Sandbox. And and within the Sandbox today, we're going to be talking about the TRUE initiative as well. TRUE stands for Technology Readiness User Evaluation. It was a term that HTDC had, and we gladly adopted it. But let me start off by telling you about a little bit of an embarrassing story. Okay, I joined Central Pacific Bank about 1.5 years ago, and when I first joined, I decided, okay, I'm going to go out and meet a lot of customers, and so I've been doing that. About a month into it, I visited this one client. And I was trying to make sure that we were being of good service in all of the different products and services that the bank offers. And then the guy told me, he goes, "Oh, gee, Catherine No, your president was here just last week." And I had no idea. I didn't know she was there. And she was actually going through the same discussion and introducing all those products and services to the client. So right there, clearly we weren't coordinated. We didn't have one central database of customer information. It became very obvious. And so it's not good, from a relationship perspective. It's also not good from the perspective that, our bank may not be, fully, on a holistic basis being of good service, to that customer. And that's when we started engaging with Deena Tearney and Pacific Point, who's very involved in this event today, and I think you're kind of sponsoring it too, so thanks a lot, okay? But I talked to Deena. She's an ex-IBMer like I am. I used to head up IBM in Japan for many years. And then so we were introduced through Deena to Salesforce, and CPB is running right now doing a bunch of pilots, and we have some Salesforce people here in town too. And so we're trying to fix that. Right? And we're still in process. Many of you might have read recently that the bank is trying to double down. We're trying to redo all of our technology now, so we could be even more customer-centric. And we hope to get a lot of that done over the course of the year. But anyway, CRM, customer relationship management, that's a topic today, but that's just one of the issues that many businesses need today. And when I was in Japan with IBM, Japan seems so advanced, the bullet train and elevators run so great, but it's just millions of lines of code. They are so antiquated on programming, okay? And it has nothing like a lot of these cloud-based services that many of you are already aware of, and that's a de facto standard in the mainland, for example. But when I came to Hawaii, I have to admit, you weren't quite as behind as Japan, but Hawaii's also a late adopter of technology. And yet, we're struggling for more productivity, efficiency. We want to pay our people more. We have the ALICE report, asset limited income constraint. That's 50% of the population not making enough money to make ends meet. And yet we're late adopters of technology. And if you go anywhere in the world, you'll find out that people who are tech-enabled make more money, right? So there's a demand, there's a need, and you have a gap. You have people, a lot of workforce that is not tech-enabled today. And so the purpose of this facility, in conjunction with DBED, HTDC, a lot of our tenant companies that have moved in here, one of the first was Servco Pacific with Peter Dames, Island Holdings and Paxa, with Cobra Matsumoto and Kelly Ueoka. And then we've been very fortunate to get Hawaiian Airlines in here, Hawaiian Telcom in here. Maybe I'm too early to announce, but just to make sure that this is not CPB centric, we'll have First Hawaiian Bank coming in here shortly, right? So we have some really good enterprise tenants here. But this isn't just a company thing. Most of these companies are moving in their innovation teams, our digital teams. We want to innovate. We want to disrupt, what we're doing today. And we're going to interact, especially in this floor here and some of the spaces in the back, with small, medium enterprises, with entrepreneurs, with startups. We want the startups to understand corporate pain points. so they can develop new solutions that are relevant in Hawaii. Because if they're going to do something that's global, they might want to be in Silicon Valley because that's where the money is, right? But if they're going to elect to be in Hawaii, they should understand what local businesses need. Because, you know, we'll cut a check, right? You know, if you save us money, we're going to pay for that. So, you know, so that's the kind of environment we're trying to create. We are working very closely with the University of Hawaii, West Oahu. HPU, John Gotanda was just here, and you know they're very interested, and we're delighted about that. They're also a Salesforce user, by the way. You know, and so we will be having many free interns. We pay for commuting, parking, but fundamentally they're free, and the reason is that they get credits to graduation. And that's a win-win for businesses and a lot of the students as well. So through this process, we're hoping to tech enable more workers, more graduates in Hawaii, and hopefully that's going to end up allowing more people to make a better living in Hawaii. So this thing is all about Hawaii. And you know, you're here today and you're going to be listening in on the CRM presentations. Some of you may be way ahead. You may say, hey, I'm already doing that, you know, I'm not learning much here. This isn't a one-way street, it's a two-way street. So if you're really ahead, you're in advanced, think about giving back to the community. Come back here and teach some of us, you know, what you do well. You know, that way we stay as a community, we get stronger. So that's what this place is all about. I thank you very much for coming today, and I really hope you enjoy you know, this event tonight. Okay, thank you.
So first of all, I want to thank you guys for coming to tonight's event. We are very proud, a specific point for me personally, to be part of True and to rally, you know, not just the clients and businesses that we work with, but to really expand that to under the umbrella of True, with CPB's partnership, as well as the Chamber of Commerce. So there's a lot of effort that went forward to today, and I appreciate you guys having an interest. And our goal is definitely for you guys to walk away inspired. And even though this is sort of healthcare focused, this is her use case at St. Francis, Hawaii, which we'll jump into in a moment. I really want to have you think about this conversation really from the concept of innovation, to Paul's point about how this can give you some inspiration and ideas about how you can improve business, think about things in a more customer-oriented way. So I think your mic is working. You want to do a quick check?
Yes. Yep, it's working.
All right, good. All right, so first of all, Melissa, I would love for you to introduce yourself to this amazing audience and share your role at St. Francis Healthcare and what you're responsible for.
Okay. So I wanted to also thank everybody for coming. When Deena asked me to come and speak, I was like, what do you want to hear me talk about for? You know, so, but I think it's really cool, and I hope you folks get out of it what we're doing here at St. Francis. And I'd just like to introduce my CEO. He's sitting over there in the crowd, like glaring at me, making sure I don't screw up. Jerry Correa is out there, so thank you. So I kind of want him to turn around, but anyway, so yeah, so I'm Melissa Ah Ho-Mauga. I'm the VP of Client Services at St. Francis. What does that mean? What does the Client Services VP mean? It means a lot of things. I oversee a lot of programs at St. Francis, but before I get to that, I was born and raised here in Honolulu. I'm a graduate, Honolulu High School, anyways out there. And humble beginnings, very humble beginnings in Honolulu. And I'm very proud and fortunate to have the opportunities that I've had in the business world. One of I call it my first real job. So after graduating, I went to Honolulu. I then graduated from University of Hawaii, West Oahu. So I'm glad that you folks are really working with them. Yes, that's when they were in the trailers at LCC. So back in the day, way back in the day. So yeah, I'm old. But the other thing is, after that, I went to get my master's. So I got my undergrad degree in social sciences. So I have a psychology degree and I have a sociology degree. After that, I was planning on going into social work. And when I went first year at UH to do my social work, I got into the MSW program at UH. And I was like, after the first year, I was like, this is not for me. This is definitely not for me. I needed to do something else. The world out there was very sad. I was working with a lot of juveniles. And the experiences out there, even though I know they needed the help, and I have a heart for the social services industry, I said, this is not for me at this time. So I went and I changed and I did my master's, I changed into business administration at Chaminade. Best thing I did, it opened my eyes to a lot of things. It opened my eyes to business. It opened my eyes to relationships, really communicating with people. So I landed what I call my really first real job at HDS. So I was at Hawaii Dental Service. There, yep, I know, yep. There. So, back in 1996, it was a tough experience. But talk about being, we're sitting here talking about CRM, but that's where I really got my IT background or focus. We had a VP there, his name is Raleigh Awaya, I'm not sure if many of you know him. We also had a CEO there, Wesley Park, and they were innovators. Talk about innovation, talk about technology, they were way ahead of their game. And HDS, because many of you guys were there when I was there, as you folks know, it was very driven. We built our own system. So I was sitting in IT, had nothing to do with IT, but our VP at HDS at the time had me sit in IT for 8 months. I called it Siberia. I'm Siberian. I hated it, but it was, it was tough, but anytime I look back on anything, it's always that experience because that gave me the foundation to look at a variety of things and look at different perspectives and how we deal with people and how technology can move us forward. So my role at HDS at that time was in the claims department. So what I did was I had to code in the system every tooth and surface in your mouth. So does anybody know how many teeth you have, or your normal people, how many teeth you have in your mouth? 32, normal people. Okay, so that's an average. Normal people are 32. So having to code every tooth and surface that we did in there. But again, that laid the platform for learning about integration, learning about relationships, learning about how you need to keep a pulse on the landscape of what you're doing, and how we can help and have technology move us forward. So really that was what it was about. Then after that, I went to St. Francis. This is my 3rd time back at St. Francis. That's all I have to say. Because
You love it. You love it.
I mean, it's been a challenge, but what I was able to do at HDS helped me to transform what we're doing here at St. Francis, which is very amazing.
Absolutely.
And a lot of it is attributed to our CEO. I mean, he's a former CIO, so even though we're going to talk about a lot of these things in the presentation, but even though he's a CIO, I keep him out of a lot of things because he's very disruptive. Because he wants to do a lot of things and touch, and we're like, no, you cannot touch. No touching, like no asking questions. But I give him a hard time, but really for us, I'm thankful for him to have that vision, because if not, we couldn't do a lot of the things that we want to do at St. Francis. And in terms of the community, being able to give back to the community like Paul talked about.
Yeah, very cool. We said this was an honest discussion, so this is very good. We're going there early. For those that aren't familiar with what St. Francis Healthcare is all about, we do have on the slide your vision, and I'm going to go ahead and switch, if you don't mind, Jeff, because it was really interesting. We started working on my side. I started working with St. Francis. I want to say it was 2017. Miros and I were just talking about this because Miros on my team was one of the early ones that were working on your project. And I remember when we first met, and you pulled up a version of this, and it literally took me to what Salesforce always talks about. And we hadn't even had a single conversation with Melissa, and she was putting the client, her customer, at the center of everything she did. And I was literally like, this is the playbook from Salesforce. Like, she was out there in terms of innovation under Jerry's leadership and your background and everything. And for those in the audience, I think, again, to provide some context as we get further into the discussion, would you mind sharing what is the mission of St. Francis? What is it that you're after here with this goal slide that everybody can see?
Yeah, so our goal, I think many of you are aware in Hawaii of St. Francis and where we were. We used to have 2 hospitals And I know Jerry's like chomping at the bit because he likes to tell the story about it. But but St. Francis, we've evolved over time. And so we used to have 2 acute facilities. And back in 2012, there was a decision made to sell the hospitals. We thought were going to be 2 hospitals. One, we sold the west side to Queens Medical Center West. And then the other one, we had to figure out what are we going to do. But the board had asked us at that time, what do we want to look like? And so that was posed to Jerry. And he had to come up with a vision because at that point in time, we were losing money. We had to leave the facilities open at the Liliha campus. You still had to have running water. You still had to have electricity on. You still had to, basically have fundamental operations even though it wasn't being used. Mm-hmm. But what in the future did we want to look like? St. Francis want to look like? So Jerry and the board and the leadership team, got together and said, hey, we really need to look at our senior elder population. That's where our focus is. Because a lot of the seniors were aging. We were getting a lot of feedback to say, hey, there's seniors out there that are not getting the support. Mm-hmm. We have a lot of seniors that need services, but they're not covered by insurance. What are we doing about it as a community? So for St. Francis, our mission is creating healthy communities in Christ healing ministry. Okay, so what is a healthy community? To everybody, it's different. It could be my community at home, your community at your workplace, your community at your church. It could be anywhere. But what does it mean to you? So for what we had to do is we did some market studies. We've talked to different people. Jerry more so went out to talk to a lot of the CEOs in the community and said, hey, what do you folks need? What do you need? And so the needs of the community came first, and we said, hey, these are what the seniors are needing. They're on a fixed income. They need to be able to get services where there's not a need, but we also need to be sustainable. There needs to be a mission and margin. But again, how do you balance mission and margin? And for St. Francis, most of our programs were heavy mission. So back in 2014, we had to make a really hard decision, and we made these tough decisions by closing programs, such as our home health program, and we had to get back to what our core business was. But we also needed to figure out, is this the model that we wanted to do in the future and wanted to look like? And so for us, we were heavy medical when we had the acute. So we had a heavy medical model of care. But then what it evolved to is we had to bring in, okay, there's a social aspect to it. There's a social determinants of care. There's caregivers that are caring for their loved ones. There's employee groups that are having issues with their employees because they're having to take off to take care of mom or dad, grandma and grandpa. Mm-hmm. How do we help those people? And so Jerry had come up with this vision diagram. Basically, the client and caregiver is in the center of that. Now, even though it's a health care model approach, it can be utilized for anything. And for St. Francis too, one of the biggest things is we're not afraid to partner. Partnerships need to be vetted, of course. They need to align with our mission and values, but we are not afraid to partner. We've worked with some companies that said, okay, what's in it for me? Mm-hmm. And they kind of guard what they were gonna do and, oh, this is my piece of the pie or my money. But for St. Francis, that's not what we're about. We're all about collaboration. We're all about ensuring that the customers that we service are getting their needs met. And so that's a hard approach, to take and for some people to swallow. Mm-hmm. Because then you also need to look at sustainability and how do you make that work. Mm-hmm. And so, so that was the first thing. And this has evolved over time. Mm-hmm. I mean, you've seen it through the years, and Jerry has no problem adding more services. And then I always have to ask him, okay, you need a date? Like, can you put a date on this? Because it evolves over time. So how am I supposed to know, where we are? But, he's learned. So that's a good thing, over time. But it has evolved, and it looks busy. There looks like there's there is a method to the madness. But after this has happened, after this has evolved and been massaged, been talked to with various people, it's okay, now how do we make this work from a technological standpoint?
Yep, absolutely.
Yeah.
Very cool. And I want to pause right here and just set your expectation. There is an allotment of time for Q&A, because I'm thinking your mind is going off of all these really cool background that you're giving us. And just to let you know, there will be a moment for that towards the end. But speaking about the customer-focused vision, I think that's such a huge observation when you look at this. And I remember some of the early conversations we had even about And again, like super innovative, especially several years ago, talking to a Hawaii organization like you guys, was like when a customer calls, when a client calls and they're asking about this, I want to be able to look at that customer and know there's these other programs. And I think that's kind of the model that you're looking up at the slide. And it was a really great way to think about the customer. It was just like my first conversations with you were all about put the customer at the center. And so we saw that with some of the projects that we have. So thinking about that, and to your point about how this diagram, it certainly has changed. There's been a lot added over the years. I think about digital transformation on a platform like Salesforce, and a lot of times we tell our customer it's a journey. And I would say that from my experience working with you, and definitely our team's experience, I think anybody on the team can say the same thing, that it's certainly been a fantastic journey with you. Like you've really figured out how do we start, how do we go on this path, and you've taken this constant iterative approach about how you work on your digital transformation. So I want to start at the beginning of the Salesforce part of the journey, because we talked about now we're transitioning to technology. How did you get to the point where you're like, okay, we've got this vision now, how do we bring technology into it? What got you to that place?
So that was, again, a huge discussion because we've looked at a variety of systems. I mean, as you folks know, a lot of the healthcare agencies in Hawaii use Epic. So we've looked at Epic, we've looked at McKesson products, MedHealth, and then we had gone to, Jerry and I and some of our leadership team had gone to visit an organization in Seattle. And then we've talked to a variety of people, even on the mainland, primarily on the mainland, not so much here because there weren't too many users of Salesforce. But we learned when we went to this Sound Generations in Seattle, they were using Salesforce for like 10 years. Mm-hmm. And so they introduced us to this. And we've, like I mentioned, we talked about to the other organizations who they had referred us to that were saying Salesforce. And so that was what sparked this. Is like, why weren't we using this all this time? Mm-hmm. You know, where were we? Were we so behind, like Paul talked about? You know, were we so behind in the technological advances that we just lost sight of what we were doing? And I think part of it is that. Mm-hmm. And so what we did is we then said, okay, we made a decision, okay, we're gonna go with Salesforce. And we were fortunate. I wanna thank Gordon Bruce out there. Thank you, because he's the one that actually introduced us to Pacific Point. But what we had to do is, when we sold the hospitals, there were so many disparate systems out there. And so when we are talking about all these different programs, and I need to mention, you know, I mentioned that I'm client services, so I oversee a bunch of the programs, but I also oversee like patient accounting, call center, quality, the adult daycares, our hospice program, our preschool. So a lot of the things are we're looking at. But when we service a client or a customer, what is the customer experience going to look like? Because say, for example, they're receiving bathing services. How do I know that they're also in a different program? We don't. And so what we had to do is we had to decide as a group, okay, what are we going to use? What platform are we going to use in order to bring all of these services online so everyone in our organization could see? So what we chose Salesforce, what we did was we said our plan was to wrap Salesforce around our current systems, legacy systems, and start decommissioning our legacy systems. So that was our initial thought. Yep. So that was, and it was hard. Mm-hmm. It was a hard decision, not an easy one. So that was the approach that we were going to take. And so that's how we got into this. But I want to talk about the customer experience because for me, who is the customer? It's not only the external customers that we're servicing, but it's also the internal customers. So we talk about, you know, our users, our user groups. A lot of that, we're really transforming culture. The culture of the organization, the culture of, and setting the future on what we're doing in digital transformation.
Yep.
So we're transforming people, growing people.
Yes, and we're going to talk about that. I agree, we should talk about that some more. I think maybe a good topic right now might be just bring us up to date. So you did a technology assessment. Salesforce started to become the common theme as you were meeting with different organizations. Then you dove into that. It's funny because I remember meeting you, and then all of a sudden you went off to Dreamforce and you came back and you're like, okay, so we're going. And I was like, what happened at Dreamforce? Yeah. I don't know if you want to share anything about how that you finally were like, this is it, and then. I want to kind of get up to date. Like, it's been a few years, and I want to have everyone kind of learn what you've been doing over the last 3 years.
Yeah, so when we went to Seattle, Sound Generations, their IT staff said, hey, you need to go to Dreamforce. what is Dreamforce? They're like, oh, it's this place, you go in San Francisco and you kind of like meet people. And I don't know how many of you have been to Dreamforce. Dreamforce is amazing. It is amazing. But you can get inundated and you can get lost in the process. And so, but when I came back, it was like, here we're going. We just gotta go. We gotta just make a decision. Talk to Jerry and said, okay, let's go. And so that was our initial discussion, and we were so fortunate again to connect with Pacific Point, with you and Pacific Point, because you folks have really helped us through the journey. Now, when we got into that, we thought, okay, we had spec'd out, and I say we, which is myself and Becky, who is our data analytics person. She's our director of data analytics. And basically, it's just the two of us really managing this process, or this project. And so when we came, we thought we had a plan. We were gonna pick, we had already lined up certain services that we were gonna do, we were gonna convert to Salesforce. And then when we realized that, hey, I don't think that's gonna work, we really changed the game plan of our entire process. So we had about 4 or 5 things already mapped out, saying we're gonna do this program, that program. When we actually got into the meat of it, we totally flipped that chart upside down. So the project plan really changed. And it was not a nice one. And the reason we changed it because we were launching programs. So, you know, you see this, but we started in the middle of all of this. We started launching programs that did not have systems. They did not have a platform to use. And so a lot of our, for example, which is that middle circle, our care coordination team, which is staffed with social workers, they were charting on paper. They were charting on Microsoft Word. They were charting on Excel. There is no way that they could do it all. So they were taking, for one client that they were seeing, about 4 hours to actually get through the process. And we said, this is not fair to them. They're gonna get burnt out. They're gonna get frustrated. So what can we do? We decided to, again, flip this plan on its head, and we said we're gonna put them on Salesforce. And so that was our initial platform. And the reason too we did that is because that program was multifunctional. You had to have, for example, normally you have a patient or a client that you will carry through or follow through in the healthcare system. But in this program, you had to have a client and a caregiver. So that made the complexity even harder. And so we said, let's just move. We moved forward. We did our workshops, and we said, okay, this is what we're gonna do. So we went from 4 hours, the staff charting, doing what they had to do, doing their assessments. We went down to less than an hour. I said, so the time that it took, the efficiencies that it took for them to get there, I mean, it was not easy as well, because you know, we were just starting out on our Salesforce journey. The verbiage, this is what we want it to look like. So we're really thankful for, you know, Sebastian, Meros, and you to be able to help guide us through this process, because Salesforce has a different language. We think we all speak the same IT language. We don't. We don't. And so we would be drawing pictures and saying, hey, we want it to look like this. And so we were, again, fortunate to have the team to support us through this process. And so from there, it kind of just kept moving along. But again, very client-centric.
Yeah, for sure.
Making sure our internal customers were clear. We knew what they wanted, so what we would do is we would workshop with the staff and ask them what they wanted to see, but we also asked them why they did what they did. So it was a two-way street communication, because maybe when we were writing those process flows, we were changing how we do business. And so that was not an easy approach for many people, because they were like, well, what do you mean? Nobody has ever asked me what we want it to look like. Nobody has ever asked me why I do what I do. Nobody has ever asked me what I do. And so, you know, making sure that that was very clear.
Yeah.
So getting buy-in in the process was key.
Well, you're really good at that. You're really good at helping to rally the people. I mean, that was definitely, you know, I think when a lot of you guys have experience with IT transformations, and certainly there's a huge technology component, but there's probably an even bigger people component. And I think that what was demonstrated here, I think with the team and mapping out these processes with the workshops and you involving all those players along the way, and communicating every step. I remember walking in the office and seeing process maps up on the board, and you can be like, yep, so we're doing that, like coming up soon, so just FYI. And there were little things that I think Melissa did along the way that are good tips for you and for others that might be kind of facing that, that change management thing. And I think along those lines, what were some of the things that popped up? Because there were many different user groups that we've touched along the last several years. Mm-hmm. What were some things that kind of stand out in terms of their reaction, or maybe some lessons learned that others can maybe benefit from?
I think one of the biggest things was change.
Yep.
You know, we have a lot of, for us in St. Francis, we have a lot of people that have been there a long time. So when you start digging into their areas that they lived in for so many years, it's making sure that they feel comfortable, and we're not asking them the question because they're not doing it correctly. We're asking the question to try to improve the process, but to also improve efficiencies. And so once they feel comfortable with that on why we're asking what they're asking, I think that was critical. Yeah. But what we also did, and you talk about change management, is we also had to have people, primarily the staff, look at the process through different lenses. Mm-hmm. So I'm going to use transportation as an example. You know, we're launching one of our newer programs that we're launching is transportation services, and this is for the elder community. Primarily, we have a grant with Elderly Affairs Division, and just to give you folks a reason on why we're doing transportation, we have 400 people sitting on a wait list with the Elderly Affairs Division waiting for services. And waiting for services meaning just to be able to take them to a doctor's appointment. And so with that understanding, mm-hmm. it's sitting in the seat of the call center person, you know, making sure, because they will be doing the scheduling. We also looking through the lens of the driver. The driver has to make sure that they're comfortable. We have to look through the lens of the client that's mm-hmm. receiving the services, making sure that they're comfortable. Looking at the finance team, you know, so from the perspective of looking at all of those things, a lot of the relationships is there. Like, you need to be able to communicate all of that. And I'm not the best communicator, I can tell you. I'm not, but, you know, because sometimes it's just heads down. Mm-hmm. We got to get through this process. But I think when I sit back and I look at it, Salesforce actually helped us to be able to look at the different lenses to ensure that we're capturing everybody. Because at the end of the day, it's a customer focus. Yeah. But there's so many different customers, and being able to satisfy, or at least, you know, taking a 90-10 approach to satisfying the customers as much as possible.
Yeah, absolutely. Very cool. I think maybe switching gear. Well, I don't know if it's necessarily switching gears, but I remember a time, you know, when speaking about people that we worked with, and we were working, I think it was the bathing, I don't know if you can mind me saying, but it was the bathing program, where there's a program that St. Francis has for those people that qualify for this program. There's an assessment that's done, and then there's an evaluation of what types of services that will go out into the field to provide these services to the Asian community. And Melissa was in these workshops with all of us, and she was just grilling, like, it has to be this, it has to be. I mean, she was just very specific about, like, my users are this way, and I know. And then we come in, it wasn't me, but some of the guys on the team came in for the session, mm-hmm. for that user trainings. And we saw the audience. We saw her users that are these social workers that have to be bilingual and serve this type of community with the skill sets that they have. And it was just this incredibly eye-opening moment for my team to go, oh, now I know why Melissa's like this. Like, now I know why she's like, this group of people was so different from some of the other programs where she's like, okay, yeah, that's okay, and that part's fine. And this one, it was just like, no, it's gotta be this way. So I wanted to share, I wanted to think about that, because I think the other people that as you go through this program, looking at those perspectives was key. But what advice would you have for others that, like I said, have so many different user groups? How do you think about that?
Don't assume you know what they do. Mm-hmm. Don't assume you know that you've walked in their footsteps. You know, it's really, if you go in with that assumption, it's probably not going to work. And you got to be open to change. You know, that's the biggest thing, I think. We thought, you know the program, we've run it for so long, but when we're now trying to put technology behind it, and please know that a lot of our services are out in the community. So it's not everybody sitting in one room. We have staff that are out in the community servicing. So we have a mobile component, and then we have a desktop component. And so that makes it just kind of complicates and adds another layer of complexity to that process. And so being able to, because you don't want somebody to be in the field, they can't finish, for example, in this case, a bath or execute a bath because they're waiting for their phone to launch the application, or they're waiting for their phone to you're doing the two-step verification or something like that. So that's a little tough. But for us, it's really making sure that we get the buy-in from the staff. We get the buy-in from the management team. We're getting their opinion. We're looking at the process flows, making sure that they understand the process flows. Because what we're doing too is we're understanding their business, and we're letting them know that we understand their business. The other thing is they are able to say, hey, I've added value. I added value to the product, the end product. Not only for their experience, but for the customer's experience. And so I don't know how many of you are on the Salesforce platform, but we have issues with clickiness. We call it clickiness, but we don't want our staff to be clicky. We want them to click it once and it opens the app. We click to check off all the tasks that we need to do. Customer signs, I'm done. So making sure it's efficient. But I think, again, it goes back to the relationships. It goes back to people feeling like they've been part of the process. And once we got that, that's when things started moving. And the momentum starts rolling because the different departments are now asking, hey, when are we going to get on Salesforce? When is our turn? So that's exciting to hear, although we've had our bumps in the road, some things when we put something into production and then it breaks a different program. Hey, what's going on here? But luckily we're fortunate we have a local vendor with you folks that we can pick up the phone and say, or wherever, even if you're in Australia, but and I've said, hey, something's not working. But I really think that relationship is key because if the employees don't feel valued,
I agree.
And if the customer experience is not going to be a good one, it's not going to work.
Agree. I love the assumption of don't make an assumption. But the other point that you're being really nice on is that, and from my side, working as an implementer, that I think is very really, really important to the success of St. Francis's journey is having a decision maker, because you can rally all these people, you can get all of their input, and everybody can feel included, and I think you do an excellent job of that. But I think on the flip side, Melissa and team does a really good job of deciding. At the end of the day, someone has to decide, okay, great, I've heard everything, we've spent the time, now we need to roll forward. And I think that's the other piece that you're shyer about saying, but I'm going to say it because I observe it and I know my team does as well. So shifting gears a little bit, because we're going to do a demo in a few minutes, but before we do, maybe talk about just the tactile execution. So there's been several programs that have been implemented, several of the programs that you see up here that have been implemented on the Salesforce platform, and there's more to come. But what was the technical execution for you like? Some people always tell me, well, my team is only this big, or I only have this many people, or I have this skill, or I don't have that. How did you approach the technical execution of it from your side?
The technical execution is a tough one because, we have an IT team, and I can tell you we haven't really done a whole lot of collaboration with our IT team. And part of the issue or challenge with that was when we talked about moving into the cloud. It was tough. It was tough. It was a tough discussion to have with our IT team about being in the cloud. And so, because it's always we're dealing with HIPAA, we're dealing with, all these patient information, health information, and we're like, yes. But there are these things in place with Salesforce, for example, the two-step verifications, there's encryption, all of those things are being taken care of from a Salesforce platform. So for us, our team, as you know, is very small. It's myself and, again, the director of analytics, and we work with the various departments. But the technical aspect really has to do with understanding your business.
I agree.
It's really understanding the business. And for us, we look kind of a little bit schizophrenic for us because we got so many things going on. but it's really understanding the business and making sure that it makes sense. It's easier said than done, but I think for us, sometimes it's gut. And Jerry and I talk about this all the time because sometimes things just don't feel right. And I know you know what I mean because I've gone back to him like, you know, Deena, I don't think, you know, that's maybe the right thing to do. A lot of the things that we have done is making sure that we understand the business, making sure, again, the buy-in is there by everybody and the relationship with various partners. Because some of these programs that we are launching or have launched are it's not only with us. We have a lot of partners that we're working with, so making sure that they're comfortable with that, making sure that they can access the application.
Exactly.
And so that piece is tough.
Yeah, I would agree. And I love that theme about knowing the business, because that truly is the most important thing. I think technology becomes really the enabler. And when there's somebody that truly understands the business and can understand how the execution should be, the technology is the enabler in that piece. What's been the most rewarding, challenging, surprising, anything you want to share, and then we'll probably transition to demo real quick just because I'm sure you guys are interested to see it, but any surprises along the way or rewarding things that have happened?
I think for us, the most things it's been rewarding. It's been definitely rewarding to see us move, or how we've moved the bar from a technological standpoint. So we actually have started, earlier on I talked about decommissioning some of our legacy system. We haven't fully decommissioned yet, but we are starting to scale back, so the scalability of that. But I think for us, what is nice is that Salesforce actually allows us to have visibility into the different things that we're doing. And it helps us to, again, move us forward. What I think for us is the people aspect.
Yep.
We've had to learn we've actually worked towards growing people, and we say growing people, it sounds kind of weird, but it really is enhancing their knowledge and really embracing technology. And I think that has helped us because one of our toughest programs and challenges was with our bathing program.
Yep.
What do you mean we have to do it on our phone? What do you mean I have to now do use a different application? And for us, another level of complexity for us is that some of our staff is union.
Yep.
And so now it's now I'm using a phone, now I'm using an application, it has GPS, it can actually track when I go from house to house and I'm providing a service. And so now unions are looking at it as, oh, so Big Brother's gonna watch me. But I think we've gotten past that. People are because for us too, it becomes a safety issue.
Yep.
It becomes a safety issue in terms of us knowing where our staff is.
Yep.
So coming from that perspective and having that position, that has really helped us. So I think that's really what it's about. It's the people aspect of it.
Yeah, very good. Awesome. I think you've done, and maybe when we open it up for questions, talking about a culture of innovation. I feel like over the last years, I've definitely seen a transformation, even at St. Francis, where there's more readiness to say, oh, we're doing this next, and there's this constant idea of, oh, it's going to continue to evolve, it's going to continue to change, and creating a culture of innovation, I think, is really, really important.
One thing I do want to mention, I do want to mention that I've been fortunate. I've been super fortunate in having a boss like Jerry, a CEO like Jerry, because he's not only very supportive, but he actually loosens the reins for us. So, when we talk about digital transformation, that's different because normally for us, we have to go back and check. But I think the trust, having trust with who you have on your team, who you have to report to, who you have to make sure that they have confidence in you is key. That was huge for us. And so even though, I joke about it all the time by kicking him out of our meetings because he's so disruptive, but, and it's because he's Portuguese. He just wants to talk all the times. So, it's fine, but, I joke. Hey, but he knows I love him. But I think that having that trust is a big factor. So, we have CEOs, CEOs that might have a little bit tighter rein or micromanage, and it is a huge project. But I think, again, for me, when we talk about rewarding, that was very rewarding too. That he's been able to say, hey, kind of let's go.
I like that.
Yeah.
Thank you guys so much for taking the time. I think, first of all, Melissa, thank you so much for sharing your story. I know that opens up the door, and to just be transparent like that, I think is really cool. So thank you for doing that for this audience. I guess I'll just say, what's one last thing that you'll tell this audience that they should consider as they look ahead?
As you look ahead, I'm going to just say, know where your audience is coming from. And I'm talking about internal customers. I usually do an exercise when I'm doing I've done multiple presentations for various things, but I've done things on communication. And what people need to realize is where that person's baseline is. You know, I usually do an exercise on doing origami where nobody can communicate, nobody can ask questions, but basically I'm asking you to grab a piece of paper, fold it in half, and when I say fold it in half, some people will fold it this way, some people will fold it this way, and through the process, everybody comes up with different snowflakes. Now, some people may come up with the same, but there are other people that may come up with different. So if I were to say, hey, fold your paper in half, is it hamburger? Is it hot dog? And I think what is key is, and the reason I do that is so that people see from a pictorial standpoint where everybody is, and they need to understand that everybody or most people in a room may have different baselines. So it's understanding that baseline because you know what you're starting with. You know what you're starting with, and again, when we're talking about digital transformation, it's transforming people. It's transforming the organization's culture. It's transforming, improving the quality of life for individuals. And it's changing the way we do business. And I think that once you understand that and are open to that, all possibilities, endless possibilities for your organization.
Okay, are you gonna, Susan, I'll turn it over to you to close things down. Thank you.
Thank you, Melissa and Deena. Let's give them a hand for sharing your journey. So thanks for coming today. I hope all of you found some value in today's event. And Central Pacific Bank is very proud and happy to sponsor learning events like this on behalf of the True Committee. And I want to also acknowledge our co-sponsors, Chamber of Commerce of Hawaii, and of course, Pacific Point. Deena, thank you very much. So please feel free to hang around and talk story. We have folks from the Pacific Point team as well as Melissa's team. So feel free to hang around and ask questions, and there's more food and drinks. So thank you very much.